Hi, I'm Dr. Nick Campitelli. Thanks for clicking on this video where we're talking about turf toe. So if you follow the news or if you're a football fan, you may have seen that Patrick Mahomes had suffered a turf toe injury in the games leading up to the Super Bowl. So what exactly is a turf toe injury? We're going to talk about that, and we're going to discuss the surgery that Patrick Mahomes is having this week. So let's watch this video. So, what is a turf toe? Turf toe is a generic word for any injury to the great toe. And what usually happens in a turf toe injury is if we look at the bottom of the big toe joint, you're going to see two small bones, and these bones are called the sesamoid bones. They're like your kneecap, which is a floating bone within a joint. And on the bottom of the big toe, you'll have these sesamoid bones, and then you're going to have a thick layer of joint capsule that we call the plantar plate. So it's not actually a ligament, but it's a thickening of the joint capsule on the bottom of the great toe. And what we typically will describe as a turf toe is when you see this joint hyperextend. So what we think happened, and again I'm saying we think because we don't know exactly what happened to Patrick Mahomes because we aren't seeing the MRIs or actually seeing the x-rays or evaluating him, but what most likely happened is he hyperextended the great toe joint. And when you do that, you can tear the plantar plate. And it won't tear in a manner like a rope would tear, but that thickening of the joint capsule can tear, and you'll get a small opening in the joint, and it can become very painful. Now there's also, I talked about those two bones, those sesamoid bones or floating bones in the joint. Those two bones are connected by a ligament between them, an intersesamoidal ligament. That ligament can tear, and that can also result in a turf toe, or disruption of that ligament can cause pain. And when that happens, it leads to damage to the joint. So now, one of the most important joints of our foot is very loose. So every time it bends up, a couple things happen. One is you get extreme pain on the bottom of the joint because where that joint tore, it's now painful, and you'll get swelling and inflammation there. And that swelling and inflammation will cause pain, especially when you pull the toe up. So any increased motion, when we walk, we bend our toe as we're moving through or propulsing, and that bending causes pain where the tear is. The second thing that happens is all that joint swelling causes a disruption of motion, so we can't bend the toe as much as we normally do, and we need that motion for walking, or in this particular case with Patrick Mahomes, he needs it to run and to toe off and to throw. And the third thing that can happen is if that joint becomes very loose, not short term, but over time, you'll get jamming and damage to the cartilage and end up with arthritis to the great toe. So that's why if you've heard turf toe can be a career limiting injury, which has caused many athletes to end their career, it's because of severe arthritis to that joint. So what do we do for it? Well, initially, you want to stop all motion to the big toe joint, right? Because anytime that joint bends, it's pulling on that joint capsule that's torn, and it's going to irritate it and cause more tearing. So we want to put something in the bottom of the shoe. And if you've been following the media, Mahomes put an insert in that had a carbon fiber insert that stops some bending motion to the big toe joint. And this will, one, it's going to reduce pain while he's playing, but two, it can help that to kind of scar down as it's healing. And what we'll usually do is put patients in a cam walker, which will stop motion to the big toe joint to try and let the turf toe heal, or that ligamentous rupture heal. And finally, when that fails, which is what we think is happening for Patrick Mahomes, is you have to repair the ligament surgically. And there are several ways to do it, and I'll put a link in the bottom of this video that describes a procedure by a company, Arthrex, where they put a fiber tape through these two sesamoid ligaments and pull it up through the big toe joint, and then they'll actually tighten that joint capsule through what we call fiber tape, where you're tying it down and tightening that capsule, and you can do it from a dorsal or an approach on top of the foot. But also, sometimes we have to go into the bottom to repair this by making an incision under the great toe joint, and that leads to a longer healing time. So when do you need surgery, and can you recover from this surgery and still play again? Well, we hope to see Patrick Mahomes recover from this. The good news is he's young, and it's in his favor because he caught it early. If you remember, this was only several weeks ago when this injury occurred. And the sooner that you catch it, the faster your repair is, the less damage that can occur to the joint over time. So thanks for watching this video. If you have any questions about turf toe or how this happens, please leave it in the comments section below. And as always, make sure to like and subscribe these videos because I'll be posting more in the future that you'd probably want to see.